Welcome to our comprehensive guide on the Medicare premium costs for the year 2024. As we step into the future, it's essential to stay informed about the changes in healthcare expenses. In this video, we'll provide you with a breakdown of the anticipated Medicare premium costs for various parts and plans, helping you plan your healthcare budget effectively. Whether you're a Medicare beneficiary, caregiver, or simply interested in the evolving healthcare landscape, this update will serve as a valuable resource for understanding the financial aspect of Medicare in 2024. Hello, I am Michael Ferrara, your dedicated Medicare agent. My primary mission is to empower you with knowledge about your Medicare benefits, ensuring you make informed decisions to maximize your healthcare coverage. At our agency, we place a strong emphasis on education. Over the recent years, we have evolved into a referral-based agency, prioritizing the development of enduring relationships with our clients. Our agency is licensed in multiple states, and we're continually expanding to serve our clients' evolving needs, no matter where they go. Thank you for taking the time to watch our presentation. I understand that your Medicare can be confusing and overwhelming at times, but after watching this video, I hope you'll feel more confident in navigating your Medicare options. Should you have any questions after this video, or if you'd like assistance with your Medicare benefits, please don't hesitate to reach out to me. Feel free to contact me at mferrara@ferraraservices.net. and I'd be honored to assist you. And I'm also going to leave my email address in the description below this video for you. Let's dive right into the 2024 Medicare premiums, specifically focusing on Medicare Part A, which covers hospital admissions. In 2024, you'll encounter a Medicare Part A deductible of $1,632. This marks a $32 increase, and it's important to note that this deductible isn't an annual fee, but applies to each benefit period. Now, you might be wondering, what exactly is a benefit period? A benefit period commences from the day you're admitted to the hospital, and it's going to last for 60 days. So, for example, if you're admitted to the hospital and discharged after 7 days, your benefit period continues for the full 60 days. Any subsequent hospital admission within those 60 days from the initial admission will count towards that same deductible. Now, however, if you're admitted to the hospital again after the 60-day period has passed, a new benefit period then starts, and you'll be faced with a fresh $1,632 deductible. Therefore, you may encounter the Part A deductible multiple times throughout the year. During the first 60 days in the hospital, your maximum cost will be $1,632, as Medicare covers the rest of the expenses. From days 61 to 90, your daily hospital cost has increased from $400 per day to $408 per day, representing an $8 increase from the previous year. For days 91 to 150, the cost per day has also risen to $816, which is a $16 more than the previous year rate of $800 per day. Beyond day 150, there is no Medicare coverage, and you're going to be responsible for all the costs incurred during your hospital stay. Medicare Part A covers a specific range of services provided by skilled nursing facilities when certain conditions are met. This type of care is often needed after a hospital stay, and it aims to assist patients in the recovery process. Now, here are some key points to understand. Eligibility for SNF care. To qualify for Medicare coverage of skilled nursing care, a beneficiary must have been hospitalized for at least 3 consecutive days, not counting the day of discharge. This is often referred to as the 3-day hospital stay rule. The patient's physician must certify that skilled nursing care is medically necessary, and the care must be related to the condition for which they were hospitalized. Services covered by Medicare during the initial 20 days of care in a skilled nursing facility, Medicare typically covers the entire cost of the care, provided the patient meets the eligibility criteria. From days 21 through 100, there is a daily copayment. In 2024, this copayment is $204 per day. So what are the care requirements? Medicare covers care that is considered skilled, which means it must be provided by licensed medical professionals like registered nurses, physical therapist, or occupational therapist. This care is more specialized than what can be provided at home or in a non-skilled nursing facility. This has limited coverage after day 100. After the 100th day, Medicare coverage for SNF care ends. Any care needed beyond this point must be covered by the patient for their supplementary insurance. Duration of care. Medicare will cover skilled nursing care for as long as it's medically necessary and meets the criteria. But it's important to keep in mind that not all stays in a skilled nursing facility are treated equally. The focus is on rehabilitative and restorative care rather than long-term custodial care. Now, there are coverage variances. It's crucial to understand that individual cases may vary, and not all skilled nursing care is the same. Coverage may be influenced by factors such as the patient's condition and the care plan established by your medical team. In summary, Medicare Part A provides coverage for skilled nursing facility care for eligible beneficiaries. The cost structure includes a 20-day full coverage period, a copayment period from days 21 to 100, which in 2024 will be $204 per day, which is an increase of $4 over last year's $200 per day. Days 101 and beyond, you will be responsible for all the costs, as Medicare offers no coverage beyond day 100. The specifics of coverage and costs can change from year to year, as you are now seeing, so it's very important to stay informed about the latest updates on your Medicare benefits. Let's now shift our focus to Medicare Part B, which covers a wide range of essential outpatient medical services. Understanding the costs associated with Medicare Part B is crucial for seniors and Medicare beneficiaries. Here's a detailed look at the changes for the year 2024. The standard Medicare Part B premium, which the majority of seniors will pay, has risen from $164.90 per month to $174.70 per month for 2024. This marks an increase of $9.80 per month. It's important to note that while this is the standard premium, some seniors may pay more depending on their income level. Medicare employs an income-based system, which means higher income individuals may face higher premiums. The Part B deductible, which you must meet before Medicare starts covering your outpatient medical expenses, has also seen an adjustment for 2024. The deductible has increased from $226 per year to $240 per year, reflecting a $14 increase over the previous year's amount. This deductible is an annual cost, and it's important to budget for it as it represents the initial out-of-pocket expense you'll incur for Part B Medicare services. These changes underscore the importance of staying informed about Medicare costs and understanding how they may impact your healthcare expenses. It's worth noting that the Medicare program is designed to provide access to necessary medical services for seniors, but it's subject to annual adjustments to account for various factors. For those with questions about specific income-related premiums or how these costs may affect your personal healthcare budget, we are honored to help, as you can simply leave a comment below this video, or you can always email me at ferraraservices.net, which I'll also leave in the description for you below. Let's dive into Medicare Part D, which covers your prescription drug expenses for the year 2024. In the upcoming year, the maximum deductible that any insurance provider can charge you is set at $545. This represents a $40 increase compared to the previous year's maximum deductible of $505. It's important to note that unlike previous years when the annual deductible only applied to Tier 4 and Tier 5 drugs, most carriers are now charging deductibles for Tier 2 and higher drugs. This underscores the importance of reaching out to us to review your current Part D benefits. Together, we can ensure that you're on the best plan to meet your prescription needs and avoid unnecessary out-of-pocket expenses. Again, feel free to email me directly at mferrara@ferraraservices.net with any questions or concerns, or again, you can simply leave a comment below this video and I'll get back to you as soon as I can. Before we delve into the donut hole, let's briefly explain how your initial coverage works. Once your deductible is met, you'll be responsible for 25% of the actual cost of your prescription, while your Part D drug plan covers the remaining 75% of the actual cost, up to a total drug cost of $5,030. Now, it's crucial to understand how Medicare calculates the actual dollar amount to keep yourself from entering the donut hole. If possible, when you fill your prescription at the pharmacy after meeting your annual deductible, let's say your copay is $5 and the retail cost of that prescription is $100. Medicare tracks the retail cost of the $100, not the $5 copay that you paid. Depending on the drug and its actual retail cost, this can add up very quickly, potentially leading you to the donut hole. Now, I always advise my clients to check prescription costs at Sam's Club, Costco, Walgreens, or any other pharmacies to see if they can purchase them without using their Part D drug plan. This is going to help you avoid getting into that donut hole if at all possible. Now, moving on to the donut hole, also known as the coverage gap, for 2024, it has increased from $4,660 to $5,030, marking a $370 increase. You're not going to get out of the donut hole until you spent $8,000, which is a $600 increase from last year's $7,400. Now, I do want to emphasize that it's not you actually spending the full $8,000, okay? It's the total $8,000 that you spent, your plan spent, and the pharmaceutical companies have spent all together that add up to that $8,000, okay? So while you're in the donut hole, you're going to be responsible for 25% of the cost of your Part D plan, which is going to cover 5%, and the pharmaceutical manufacturers will cover the other 70%, until the total cost of all three, so again, your expenses, your plan, and the pharmaceutical company reaches a total of $8,000. Once you exit the donut hole, you're going to enter your catastrophic coverage, which in 2024, they've changed it, which is super awesome. I know we mentioned it last year. We were looking at them possibly doing it. Well, they did it. So all your prescription costs will be fully covered by your plan and Medicare for the remainder of the year, leaving with no more copays on your prescriptions for the rest of 2024. Medicare Advantage plans, also known as Medicare Part C, have evolved and improved over the years, offering beneficiaries a private insurance alternative to original Medicare. It's important to understand the dynamic nature of these plans and the reason you might consider them. Here's a comprehensive look at Medicare Advantage plans. Understanding Medicare Advantage plans. Medicare Advantage plans are administered by private insurance companies, not Medicare itself. These plans offer an alternative to the traditional fee-for-service structure of original Medicare. One key feature to keep in mind is that the benefits and provider networks of Medicare Advantage plans can change every year. So year after year, they can change their networks. This dynamic nature makes it essential to review your plan annually to ensure it still meets your healthcare needs and preferences. So why is the annual review important? By reviewing your Medicare Advantage plan, you can confirm that your preferred doctors and hospitals are still part of your plan's network. You can also ensure that the benefits offered by your plan remain the same or have improved compared to the previous year. Staying informed helps you make the most of your coverage. Ongoing improvements in Medicare Advantage plans. It's worth noting that Medicare Advantage plans continue to enhance their offerings year after year. They may include additional benefits such as dental, vision, and prescription drug coverage, making them an appealing choice for many beneficiaries. The case for original Medicare and Medicare supplement plans. While Medicare Advantage plans offer advantages, some individuals prefer the flexibility and freedom provided by original Medicare paired with a Medicare supplement plan, also known as a Medigap plan. This combination allows you to see any doctor or visit any hospital that accepts Medicare. Importantly, your doctor remains complete control over your healthcare decisions rather than an insurance carrier. Now, it's good to understand the scope of appointment. It's important to note that no one is permitted to discuss Medicare Advantage plans or Medicare Part D drug plans with you unless you specifically request information and a scope of appointment is completed. This ensures that the discussion about plan details and benefits are initiated by your request. So how do you get more information? If you have questions about Medicare Advantage plans or are currently enrolled in one, I encourage you to reach out to me. You can send me an email or leave a comment below this video to schedule a no-cost review with me. Prior to our scheduled appointment, I will email you a scope of appointment to be completed, which is required, and it can be completed digitally through a secure email link. For those with Medicare supplement plans, there are no enrollment periods, and you have the flexibility to make changes at any time of the year, making it convenient and adaptable to your evolving healthcare needs. In summary, Medicare Advantage plans offer a dynamic alternative to Original Medicare, but they require regular review to ensure they continue to align with your healthcare preferences. Ultimately, the choice between Medicare Advantage or Original Medicare with a Medicare supplement plan depends on your individual needs and preferences. As we wrap up, I hope you now have a clear picture of what to expect for Medicare in 2024. I genuinely appreciate you taking the time to join me here today, and I hope you found this video informative and valuable. Please consider sharing it with your friends and family, and if you haven't done so already, subscribe to my channel as I strive to keep you updated on all matters related to Medicare benefits. Also, if you would, hit that like button. I really appreciate it, and it also tells YouTube to get this out to more and more people to hopefully educate and provide more information to as many people as possible. Had a little blurb there. My name is Michael Ferrara, and I am your dedicated Medicare agent. My mission is to help you understand your Medicare benefits thoroughly and ensure that you've never being overcharged for your healthcare coverage. It's a true privilege to serve as your Medicare agent. Don't hesitate to reach out via email if you have any questions, concerns, or needs assistance with your Medicare benefits. Remember, our services are always 100% free to you. We are compensated by the insurance carriers, much like your auto and homeowners insurance agent, only when you choose us as your trusted Medicare agent. Thank you once again for watching this video. I wish you an incredible day ahead. Goodbye for now, and take care. Thank you again. I appreciate you. Bye-bye.